Assalamu alaikum wa rahmatullahi wa barakatuhu. Welcome and Ramadan Mubarak. I would like to welcome everyone to Hayat Relief and NIMS, Nagami Institute of Islamic Medical Sciences, conversation on the COVID-19 pandemic in India. As everyone has seen, that the infection has been raging on, and there's been multiple casualties and deaths. Many of these preventable due to lack of resources and proper coordination. We have two special guests with us today. Dr. Safa Fazal Haq, who's been on the front line in New Delhi. She's a doctor in the community medicine at Hamdard Institute of Medical Sciences and Research in New Delhi, India, and is a core team member of Human Solidarity Foundation, which we have collaborated with, Hayat Medical Relief has collaborated with to help with their Clinic Mizan Foundation. We also have Dr. Samer Siddiqui, who is a local internal medicine doctor as well as acute care physician in Elmhurst, Illinois. He is part of the COVID task force at his hospital and is up to date on the latest research going on in COVID, and he will be our moderator for today as well as myself. I would like to welcome Dr. Safa and Dr. Siddiqui to the broadcast.
Assalamu alaikum, everyone. I hope everyone's having a great Ramadan. Thank you, Dr. Shahabuddin, for the introduction.
I think we will also add Dr. Safa to this conversation right now. All right, great. One thing that I already wanted to I wanted to include Dr. Siddiqui on this conversation is that he has quite a few family members in India who've been affected with COVID, and obviously Dr. Safa has been seeing patients there on the ground every day to give us a better perspective. Dr. Siddiqui, if you want to start our session, go ahead.
Yeah, assalamu alaikum, Dr. Safa. Thank you for having a conversation with us. I think the biggest question is how are you doing, and how's your family, and how's the care that you've been providing in Delhi?
Right, Alhamdulillah, I'm good. I'd say every day is different. Yeah, some days are bad, some days are all right. So I'm very happy. I'm glad my family doesn't live in India. They live in Saudi Arabia. So I'm very, very glad that they're out of this situation, Alhamdulillah. Yeah, so that's a big relief. Yeah, and apart from that, every day, like I said, is different. However, the cases are still rising, and there are still a high number of cases every day here in Delhi, and there are still a big number of deaths also happening. It's the highest in the country. So yeah, that's going on. But we're seeing a glimmer of hope right now. I think things will start to get better, inshallah. It's better than what it was at least last week.
Okay. If you remember when the first wave hit last year, sometime in March, and as a physician, you're going into this unknown pandemic, and you have no idea how it's going to affect you or your family members, and you have this fear of bringing, God forbid, this back. Do you kind of feel like this new wave that India been getting hit? Are you a little hesitant to go into work these days, or are you confident of your practices of protection?
Well, honestly, I'm not hesitant at all. I think I would beat myself up if I would sit at home not doing anything. So I'm glad, alhamdulillah, that I have an opportunity to actually help out directly with patient care and through the other activities we're doing through our organization as well. So yeah, of course, there's PPEs, there's masks, and there's everything that we wear when we go into the COVID wards and ICUs. But you're constantly in that environment for like 6 hours, 12 hours. So it's eventually it's how much are you going to save yourself, right? But alhamdulillah, that fear hasn't creeped in. So I'm happy about that. But yeah, it's actually a blessing, alhamdulillah. And I think healthcare workers are privileged right now to be able to help out in this situation because it's a pandemic where the people who can help out are doctors, nurses, paramedical staff. So I think we should be blessed to be among those people who can help out directly.
Wow.
MashaAllah, it's great to hear. And do you feel like you guys have adequate supplies for PPE, medications, etc.?
We have some troubles, but alhamdulillah, it's handled well. We have constant flow of PPEs. I think right now we're not struggling with PPEs or medication, but we did have like in our hospital, in fact, the Hakim Abdul Hamid Hospital in South Delhi, we had in the span of 48 hours, we had 3 oxygen crises where we had to send out SOS, calls for help, that we were running out of oxygen within half an hour or 1 hour. And we had tankers coming in at the very last moment and refilling oxygen. So we had that situation just a few days back, but fortunately it's better now. Yeah. The Delhi government, the Chief Minister Arvind Kejriwal has ensured that there is enough oxygen now for Delhi and for providing enough oxygen to have a good number of oxygen beds and ICUs in the city.
Did you see any people like desaturate and then pass away within the hospital, or just not even make it to that level of getting to oxygen?
We've had so we're running a COVID relief helpline through the Human Solidarity Foundation. So we do get a lot of calls from distressed people who are asking for ICU beds, for ventilators, for oxygen beds, and for oxygen cylinders. And there's been a very bad situation here where people are not able to get the right kind of help at the right time. So we do send out messages on groups for anybody who can help them out to try to arrange oxygen cylinders or anything that they want. But sometimes it reaches them on time and sometimes it doesn't. So yeah, there is an acute shortage of things here. And but there are lots of people who are trying to help out, who are trying to pitch in and do their part. In our hospital, in fact, like I was in the COVID ICU once when the oxygen almost ran out. So when the ICU started beeping because the oxygen level, the monitor was red, and yeah, it was like we were just looking at all the monitors to make sure nobody's SpO2s are, nobody's desaturating, and it was a very yeah, it was a scary time. But I knew that Dr. Aksama was out there, and she was trying to arrange for. She was one of the people who was trying to arrange for oxygen tankers to come to the hospital. So I messaged her immediately, asking her what's the situation, and she said that the tanker's here and it's refilling. So yeah, within the next 10 minutes, the monitor went back to green. Yeah, but it was a very, very, we all went into a panic that time.
Yeah.
Because there's no alternative to oxygen, right? Like everyone started arranging for ambu bags in case the patients start needing it, but there's no alternative to oxygen, right? There's nothing else you can do if oxygen runs out.
Yeah, no, I think I like your perspective, and we need physicians like that. This is a blessing and a ni'mah to have this knowledge to help people. God willing, this might be our ticket for the afterlife. But having that perspective that this is our chance to help society and humanity, that's where we need to be. That's why a lot of us went into this field of medicine. Tell me a little bit about the telemedicine app that Mizan Clinic is doing and how you're triaging people. My first question, and then the second thing about how you have a pool of doctors who are volunteering their time from the United States and locally.
Right. So right when the second wave started, Dr. Aksamam had the idea of setting up a COVID relief helpline. So there were a lot of people who were not able to access hospitals and talk to doctors because hospitals were already overburdened, and people had a fear of going to hospitals and meeting doctors there. So um, a lot of people diagnosed with COVID were advised to do home isolation, so they needed to get in touch with a doctor. So our team at the Human Solidarity Foundation set up a COVID helpline. So basically, our idea was that we'd address any um, issues related to COVID, not just patients, but anybody who has any questions related to COVID or vaccinations can call our helpline and clear their queries. And also, people who are in home isolation can contact one of our doctors and get in touch and get help, get medication, a prescription, and get the right sort of advice. So, Alhamdulillah, we have over 100 doctors now who are volunteering um, volunteering their time, their efforts in talking to patients and doing teleconsultations. And we've been up for around 3 weeks now, and we've seen over 1,800 plus patients, mashallah. So
Okay.
it's going really well, alhamdulillah. Yeah.
Okay, mashallah, that's awesome. So what do? They call in and they're connected with the doctor. Is that how it works?
Right. So we have a whole workflow. So we have a few volunteers who are the call operators. So they are the ones who receive the calls, and then they do some basic triaging. What we focus on is mild and moderate COVID because for severe COVID, we just advise them to go to the hospital. We can't tell them to stay at home and seek help through teleconsultation. So we focus on mild and moderate COVID. So the call operators then judge that and forward the calls onto a WhatsApp group that we have with all the volunteers, all the doctor volunteers. And then the doctors who are available during that time slot take up the cases one by one. Yeah.
Okay. I think one other question we were talking about earlier was how has the vaccination rollout been there?
So the vaccination drive started on 16th January, and it started in phases. So during the first phase, we were just focusing on the healthcare workers, and then soon we also focused on the frontline workers, and then we went on to the elderly and those with comorbidities. Right now, since the 1st of May, we have started vaccination for uh, the population of 18 years and above. Until April, I think the vaccination drive was going all right. But since the second wave has hit, we've seen an acute shortage of vaccines everywhere. Uh, the problem is that since the drive has expanded to a larger population now, the companies that are providing the vaccine are not able to keep up with the requirements. So of course, that's understandable as well. They can't just ramp up their production overnight. So they have a requirement right now. Serum Institute of India is providing the Covishield vaccine, and the government has asked them to provide around 11 crores doses of vaccines. So it's happening, but it's very slow. And right now, only the central government is the one who's receiving the vaccines. So we had a big number of vaccination centers here in Delhi initially, but right now, all the private vaccination centers are closed. Only the central government ones are running. So there's a huge crowd that's trying to get themselves registered and trying to get vaccinated, but the slots are filling up just as they open up. So there's big crowds coming to the hospitals to get vaccinated, and it's not very smooth right now, and it's definitely the administration's fault for not planning this better and having doses ready when we needed it, because the final and foolproof way to address the situation is vaccination. So that's definitely something we need right now. Thankfully, Delhi government yesterday announced that they are getting the right amount of doses right now, and they will cover Delhi's population within the next 3 months. So inshallah, let's hope that happens.
It's great to hear. So I had a question about, you mentioned that you guys are treating moderate and mild COVID. So how are you monitoring these patients? They're coming into the hospital, you're doing some basic labs, and then you're sending them back home. Is anyone keeping an eye on them when they go back home, or how's that going along?
So we're focusing on the COVID patients who are in home isolation already, who are advised home isolation. So especially mild cases are advised to just stay at home because the hospitals are already overburdened, so we can't really have everybody getting admitted.
Sure.
And mild cases can be easily managed at home, right? So we have, so our doctors, they assess the patient's symptoms and their history, and they advise them the right kind of medications and ask them to get lab tests done. And most of the patients have attendants at home or families and relatives at home. So their families, we tell them how exactly to keep monitoring them at home, and we tell them to get the right sort of instruments, like get an oximeter at home and thermometer, and we tell them how to use it and what are the things that you should keep monitoring regularly. So that's what we're doing for mild and moderate COVID. Yeah, and if we see that they are that they're desaturating or their fever is too high, any of the dangerous symptoms, we advise them to immediately go to a hospital or start arranging for oxygen.
Okay. And so I'm assuming you guys are checking inflammatory markers, the lab values, like checking like D-dimers and CRPs, basically.
Yeah.
And then managing based on that, basically.
Right. Yeah.
How easy is it when you tell one of the patients that's not doing too well to go get admitted to the hospital?
It is a sort of a panicky situation for the families because it's very, very, very difficult to arrange for hospital beds, and we've tried it personally. I've tried it, and it's very difficult to get through to a hospital and you know, have a number answer saying that we have a bed available. That's not happened in my experience. You most of the time you need to have some some connections in the hospital where somebody can tell you, yeah, we have a bed available. I'm reserving it for you. Come quickly and you get admitted. So that's the situation. People have had to travel 5 hours outside Delhi to go and get a hospital bed. So we know our limits as as a helpline and as a foundation. We know our limits. We know that we can't take up the responsibility of providing for hospital beds. So we inform the patients that you have to arrange for a hospital bed very soon, but we're sorry, we can't provide you that. And then we try to help them out. We try to sell. There are lots of groups that are sharing resources for oxygen beds that are available. There are lots of Twitter pages. So we try to send them as many resources as we can, and and then we just hope that they find something soon.
So some of these people that obviously are getting sick, and we're hearing a lot in the news that they can't find a bed, and either you need money to get a bed, or you have some connections, like you're saying. So are you guys providing any kind of medications like Decadron, steroids, maybe like an aspirin or something, or like remdesivir or Temra, any of that? Are you guys instructing the families to do any of those?
Drugs like remdesivir are, have been approved for experimental use here in India. So they are only supposed to be used in hospital settings. So we definitely don't advise them to, run after remdesivir because there's a mad race for remdesivir here, and it's actually supposed to be the hospital's responsibility to arrange for remdesivir. It's not supposed to be the families and the attendants' responsibility. So we don't entertain any requests for remdesivir, especially if the patient's at home. Apart from that, everything else that's in the guidelines, there have been lots of guidelines that have been shared by AIIMS Delhi and a lot of institutes, so by the government of India itself. So we are following those guidelines, according to the patient's history and their symptoms, we give them the drugs that are allowed to be taken at home.
Okay. Yeah, we've just been hearing a lot of these things happening back home from different sources about people trying to get remdesivir or like Actemra, and it is dangerous. These should be done in a hospital setting, but if you don't have any beds, it's kind of difficult to do that. And so I guess the biggest question is I wanted to ask you was, have you seen, obviously you've seen severe COVID and moderate COVID, but anyone who's been fully vaccinated with the AstraZeneca, which is the Covishield, have you seen anyone not make it after being fully vaccinated with the Indian mutant?
Right. So there are lots of things to address here.
Yeah.
So firstly, yeah, I've heard of cases where people who have been completely vaccinated have also not made it. But I've also heard of a lot of cases where people with comorbidities and elderly people who had a high likelihood of going into severe disease have been protected because they were completely vaccinated. In my personal experience, so I've been posted in the COVID ICU. So in my personal experience, most of the people who are there with severe COVID are the ones who either are unvaccinated or just got their first dose. Yeah. So that's an observation, and yeah, I think there are a lot of people who have said that yeah, they recovered from COVID after getting their second dose, and it didn't progress to severe COVID. Yeah, and I think you mentioned about the mutant in India, right? So
Yeah.
yeah, there is a rapid spread of what we're calling the double mutant because it has two mutations. But most of the manufacturers of the vaccines have said Covaxin, Covishield, even Pfizer have mentioned that their vaccines are effective against this double mutant. So to address it simply, like since there are two mutations, it doesn't make it highly dangerous mutant virus because even though one mutation escapes from the neutralizing antibodies, the other one is countered by the antibodies. So in all over, it is giving protection against the mutant viruses as well. So we don't have to worry about that.
Okay.
That's great.
We have one question from the audience. How quick is your response time for getting back to patients? Do you get SOS calls? If so, how do you manage them?
Right. So we have, fortunately, Alhamdulillah, we have a lot of doctors on hand right now. So we do get SOS calls. We do get calls from attendants who are, they are crying and distressed and they want help right away. And their relatives are desaturating really fast, and all of these situations. So we have a lot of doctors on hand. So Alhamdulillah, our response time is right now it's within half an hour. We address the calls. So from half an hour to 1 hour, we address all the calls that we get, and SOS calls are immediately assigned to a doctor, and it's taken up within 10-15 minutes.
So that's pretty good. Within 15 minutes. Okay, good. I think we talked about this a little bit beforehand. Which vaccine do the majority of people get? I think you said Covishield, and which one is that?
Right. So the ones in India right now are the Covishield and the Covaxin. The Covishield one is the Oxford AstraZeneca one, which is being produced by the Serum Institute of India. And Covaxin is the indigenously produced vaccine by Bharat Biotech. So we have these two vaccines that are currently being used in India. And we have news of the Sputnik vaccine soon coming too. Yeah, so the one that's mostly the Sputnik vaccine.
Oh, from Russia.
Yeah.
I've been reading great results from the Covaxin trials, that it's been doing a great job with all the variants. So is that available to the public right now? Like, do you have an option of getting that? Oh, okay, good,
yeah,
great.
It's been available since the vaccination drive started.
Oh, great. Wow, okay.
And which is the one that's made in India?
The Covaxin one. It's been developed and produced by Bharat Biotech.
So do you think this intellectual property dispute that's going on with Pfizer and Moderna I don't know if that's affecting anybody, or do you feel confident in the current vaccines that you have on the ground there, that they're preventing serious illness?
So we don't have Pfizer and Moderna in India, and I'm not sure about when and if they will make it to India. So the Pfizer one definitely requires, pretty expensive infrastructure. So we'll see when that rolls around to India. But the current vaccines that are in use here are definitely preventing diseases and preventing people from developing severe COVID. Yeah, there's one thing that I say pretty often is that it's important to remember that these vaccines are not disease preventing vaccines; they're disease modifying vaccines. So they don't guarantee that you won't get COVID, but they do guarantee that you will be protected from severe COVID or death. So that's definitely something to remember.
How much of the population do you think got vaccinated since January?
It's around 9. It's less than 10%.
Oh, wow. Okay.
Yeah.
Less
Yeah.
than,
So we have a long way to go. Yeah.
Yeah.
here, there's a lot of COVID or vaccine skeptics, like
Yeah.
in general, and then for some reason they tend to be different populations. Have you seen that in one particular population or another?
I'm sorry. What was the question?
Is
The
there
vaccine hesitancy.
Yeah.
Oh,
It's
yes,
talking about, yeah.
definitely. There's a lot of vaccine hesitancy. So people, I think people in India are very dependent on WhatsApp and the news that comes on WhatsApp and circulated there. So yeah, there is a lot of vaccine hesitancy, and we saw a lot of that uh, before the vaccine drive started. We were still dealing with that after the vaccination drive began. We had healthcare workers who were hesitant to get the vaccine. But as it ramped up, people did start gaining more confidence, and they did start coming in and getting vaccinated. But the biggest thing that has helped is the second wave itself. So after the second wave started, that's when people realized the importance of getting vaccinated. That's when they saw, people dying very close to them, and that's when the fear really sank in. And before that, they thought COVID was over. So you know, anyways, there was no purpose of getting the vaccine. So right now we are seeing people come in large numbers, but there is still a lot of misinformation going around. There's still a lot of vaccine hesitancy. So that definitely has to be addressed.
And what is the price of the vaccine? If somebody wants to get it right now and they qualify, what is the price, and do you think it's available?
Yeah, it is available. So right now, in central government vaccination centers, it's free, or uh, the Serum Institute one is being marketed at 400 rupees, and it can go up to 600 or 1000 rupees in private vaccination centers. And it's around the similar prices in for the Covaxin one as well. It's around, I think, 600 rupees. Before this, it was completely free, and before May, it was completely free in the government centers. And in private centers, the Covishield one was marketed at 150 rupees, and then the hospital itself could charge an additional 100 rupees. So yeah, I got my first one for free, and I had to pay 250 rupees for my second one.
And side effect
And
profile?
it's much more expensive right now.
Oh, it is. It's gone up.
Wow.
Okay.
Wow.
So I know you're affiliated with the university there. Were the med students and the professors, were they pushing the vaccine earlier, or were they like, "Kuch bhi nahi hota," or was it pretty like?
So we had a mixed crowd because I'm in the Department of Community Medicine. So it was our responsibility to spread the word and get people. Our department was kind of running the COVID vaccination center here.
Okay.
So yeah, we were trying to spread the word, trying to dismiss any myths that people had. We were trying to get people to come and get vaccinated, but within our hospital itself, within our paramedical staff and our nurses, there was so much hesitation, and we really had to work to get them to get vaccinated. We had to use different methods, like बाद में expensive हो जाएगा, फिर पता नहीं आपको मिलेगा या नहीं मिलेगा. You have to tell them things like that, like right now it's for healthcare workers, maybe you won't be able to qualify later. So we had to instill these kind of fears to make them come and get vaccinated.
Yeah, I think just as a cultural thing, I think when I do get some hesitancy, they're like, maybe why should I take an injection? I'm not sick
Yeah.
right now. Why would I take an injection before I'm sick? And I saw a little bit of that. But oh,
Yeah, I guess the main fear is like, what is this going to do to our body? We
mhm.
don't know, we don't have enough information, and that's the main concern. So there are people think that after getting the vaccine, they're going to fall sick, they'll develop fever, but that's true for any vaccine. Whether you get hepatitis B vaccination, you have the same risks of having fever after the vaccine. So, or a flu shot, right? So yeah, it's just because it's new. So anything new, and you know,
I think it's
you'll
a
be
natural
skeptical
human
about it.
response.
Yeah,
Have to
exactly.
be,
Yeah.
and especially since the technology is new and it happened pretty quickly. That's the biggest thing that I've been dealing with. That hey, it came out so quickly. Usually vaccines usually take about 2 to 3 years, especially in the Moderna and Pfizer. They're completely different technology and that they're brand new technology. Um, and we've been hearing that. I think there's a question, Dr. Shahabuddin. There's a question.
From Fayaz Ahmed, is there
Yeah.
consensus by physicians on how to treat COVID?
So there are guidelines that have been shared by the government of India and by various institutes like various prestigious esteemed institutes like AIMS Delhi. So there are set guidelines that are meant to be followed. Um, yeah, so that's definitely being circulated, and there is a common consensus on how things should be dealt with and how patients should be treated. But of course, everyone will you can't enforce the guidelines on everyone, and there is a lot of misinformation going around, and of course, the misinformation also reaches the healthcare workers. So within our team of doctors, we try to constantly keep them updated on what the recent guidelines are, what really works. We try to follow evidence-based medicine only. So yeah, we keep trying to keep them updated, and we organize seminars and webinars to make sure that they're getting the right kind of information and only giving out the right kind of advice to the patients from whom we get calls.
So Dr.
So this is
Safa,
definitely one thing that we're trying to address on WhatsApp groups and um, among healthcare worker communities. That if there's any misinformation, we try to clear that out and share the right kind of news and guidelines and research papers to make sure that everyone's on the same page.
Good stuff. I wanted to ask you a question, something that we were thinking about. So, when you're trying to get the message out to a mass population, you you need to keep the message simple, right? Isolate, wash your hands, wear a mask, right? It's simple, right? But in order to execute that all the time, it's very difficult, and that's why we're seeing what we're seeing, right? Now, in a place like India, where the population is exponential, and we thought that India would get hit a lot harder in that first wave, but we didn't hear anything. Like last August, I was hearing about people still going to weddings and people are doing fine, and then suddenly, like over the last 3 4 months, it just it took off. What do you think? Do you think it was the mutant, or do you think there's a little bit of herd immunity going on, or what do you think happened there?
So I don't think we definitely can't say that it's just one reason. It's always a multifactorial problem. So we had an extended lockdown from March of last year until I think October. So
Mhm.
after that, the restrictions eased down, and the cases started dipping very fast for some reason. And yeah, we were wondering whether we've reached herd immunity or what is the
Sure,
situation really,
sure.
because honestly, there's no real physical distancing anywhere. Like
Yeah.
anywhere we went out, there weren't people really keeping their distances. There weren't people following the wearing masks properly. So yeah, it was a situation where we were questioning why there is such a dip in cases, and that happened around November, December last year, and
Yeah.
that made everybody believe that COVID is over. That the situation is now behind us, and all the restrictions relaxed. People started going out, restaurants opened up, people started having weddings and celebrations in huge numbers, and then all of a sudden we saw everything rise. So yeah, it would have been because of the restrictions easing down and so many people coming out of their homes. It was also because of a lot of mutants coming in that were, that were more infective. And yeah, there are lots of reasons why we probably saw this sudden rise in cases and we saw this sudden, second wave peak. Also, the government wasn't taking, quick actions of putting restrictions in place or having supplies provided at the right time. Just it's been very slow in the response to COVID.
Yeah, yeah.
Now I'm seeing these videos of mass graves or mass cremations, like the aerial footage from drone cameras, like just people putting the bodies on the side of the street and burning them. I don't know if there's some superstition about some communities don't want to do it, so a lot of the Muslim communities are burning these bodies. And no, I mean, how is it on the ground? Like when you're walking down the streets, is it chaos there? I know last year in March when New York was going through the worst times, like you wouldn't see anybody on the streets. It was a ghost town. What's the mizaj, like the feeling there, and like are people social distancing now? Is there masks, and what's going on like on a day to day there?
So we're on. So Delhi's on lockdown for this is the third week now, I think, that we're on lockdown. And I personally haven't stepped out of my campus since the lockdown began. But yeah, the only people on the streets are basically people who are out trying to get help and trying to arrange things for their families. There's only ambulances on the roads. There are people out there, but most of them are just scrambling for help. So that's the situation, and definitely, yeah, crematoriums are overburdened, and they're not able to, they're getting more bodies than that they can keep up with. So bodies are being burned in parks and parking lots and open spaces wherever they can find, an open area. It's a terrible situation. Really.
So it's safe to say that
And even the crematorium workers, they're not. They definitely should be provided with PPEs, and their safety should be, it should be looked at. But most of them don't have access to, any sort of safety equipment.
Yeah, I mean, washing hands and sanitizers and masks are a privilege, right? When you're dealing with the poorer population. And how do you expect a population to follow that when you have such a large population that's in poor, and how do you expect them to use sanitizers? How do you expect them to buy masks? And then especially, in our Indian culture, in our population, there's multi-generational families living in the same house, right? And you have about 5 to 7 people living in the same house. How if one gets infected, how do you quarantine? I just feel that that's also adding to the fire, basically.
Yeah.
If you,
They
if
also,
you, oh, go ahead. What were you saying?
yeah, definitely household transmission is, it's very difficult to, for people to isolate themselves when they don't have enough rooms in their house to, isolate. And it's very difficult. We try to advise them as much as possible, but it's when you don't have that facility, what are you going to do? So yeah, household transmission is definitely something that we're seeing more of in this wave than the last one.
So I'm assuming that Ramadan has been a little bit more muted than the past. I mean, I've been to Delhi Jama Masjid and the area around the masjid. There's usually a lot of liveliness around there. Have you noticed that it's a lot more dampened and not as celebratory as usual?
Yes, definitely, and it should be that way, right? People shouldn't be gathering outside, and people shouldn't be, getting together to celebrate Eid. Everyone should realize that if you protect yourself this year, you'll probably get to see the next Eid, inshallah. And yeah, we're trying to advise people as much as possible to not gather for namaz in large numbers, and not go out to celebrate, the last 10 days of Ramadan, or you know, to go crazy, eat, shopping. So yeah, that's definitely, yeah, that's there. But it's good if there are things, if there are places that are deserted. I'd be happy to see that.
Absolutely. I mean, what I found very shocking about this whole thing is that some of the lockdowns in India coincided with the numbers here instead of with the local numbers there. Like when the first lockdown happened in America, a lot of the laborers, they didn't even know a lockdown was going to happen when the numbers were already low. So, yeah, it's hopefully this might be an alarm for the healthcare system there and politicians and policymakers that, this is a different phenomenon than what they're used to dealing with. They have to take it seriously.
Yeah, I think they did have an opportunity to address it last year. They saw the situation happen, and they could have ramped up uh, their healthcare, but I think they just slacked once the COVID cases came down. Um, so yeah, I think that everyone just assumed that COVID's over now. So like we had the government, like I was reading an article recently where the government had asked a company to provide ventilators, and then they didn't give them the initial, um, the cost that they had to pay for the production to happen, and they just let it be, because for the last few months nothing was happening not much was happening in relation to COVID. So the companies right now are saying we don't have the money to start uh, manufacturing ventilators. So what are we going to do? The government hasn't helped us. So there's a lot of things that are not happening because of um, not the right kind of administration, and a lot of red tape. There's so much help that's come from outside India, and everything's just stacked up in the Delhi airport, and we're not able to access it because of customs and red tape.
First of all, how are the healthcare workers there? How have they been protected? Have they been healthy? I'm hoping because they did get vaccinated early. What's your experience with the healthcare workers being affected by this?
Here, there are healthcare workers still being infected, but yeah, because the phase one was focused completely on healthcare workers, so a lot of them are now would be completely immunized. Yeah, but we're still getting cases of healthcare workers, developing COVID. But fortunately, most of them just get away with mild and moderate COVID.
That's good to hear. Alhamdulillah. Alhamdulillah. And if you, oh, go ahead.
Go ahead.
So if you had like a list, like maybe two or three things that you would need for your clinic, or what would you would need to help in this pandemic, what would be the top three things that you would say to people?
All right. So the first thing is to, uh, I would say, find out, communities and organizations that are doing good work on the ground, and donate to them. So if that's definitely one thing that almost organizations need right now. Apart from that, there's a lot of vaccine hesitancy that we have to address. I think if you have friends and families back home in India, then please encourage them to get vaccinated. And I think it's high time everybody realize the importance of vaccination. So, try to have a compassionate ear, try to hear what their issues are with vaccination, and answer them rationally, logically. There's only so much way that bullying can go, like Jao, vaccine lagwao. So we have to answer their
Yeah,
queries and
sure.
resolve their doubts about why they don't want to get vaccinated. So yeah, and then another thing is to raise the alarm, to highlight the issues and spread the word on social media of what are the different issues that are going on in India right now, and what the government should be doing. So just spread the word on social media, and create a sense of pressure on the government to act. So the more that people are talking about it, the more that people are pressing on the issue, hopefully there'll be a sense of, urgency for the government to act.
Inshallah, may Allah help us in these times and make everyone safe, inshallah.
I mean,
Yeah.
I'm sorry we asked you a lot of questions, but
Yeah.
just something. We have about another 15 minutes left.
Okay.
You know, I'm grateful for your work and Dr. Aqsa Sheikh here because I think it's our responsibility to, as people who give zakat and work with different organizations, to really do a little bit of due diligence to make sure we're working with people who are on the ground. There's big organizations, but one of the reasons Hayat Relief exists is to hopefully meet passionate people like yourself, and I can hear it in your voice. You see this as an opportunity to help humanity, and this is our time to shine. Not our time to run. So, if you could just tell me about the Mizan Clinic, it's something I want to hopefully be a part. Hayat Relief wants to be a part of, ongoing, and any other projects you guys are doing, so that we can maintain this connection. Number one, what that clinic is doing. Number two, how can they join this volunteer registry of physicians who are answering the call for people who are in need?
Right. So, Mizan Charitable Clinic is one of the things that have been set up under the Human Solidarity Foundation. So, Dr. Aqsa Sheikh is the founder and director of the Human Solidarity Foundation, and just a few months back, we set up the Mizan Charitable Clinic. So, it's based in Zafir Nagar in Delhi. So right now, we're trying to, in the current situation, we're trying to avoid seeing patients directly. We're also concerned for our own doctors, right? So we are also using that clinic now to do teleconsultations. So that's one activity that's happening under HSF. The other one is we are doing food kit distributions during Ramadan for the people who really need it. And the third one is our COVID relief helpline. So these are the current activities that are going on under HSF. Yeah, for any doctor, especially the ones who have a registration of a license in India, so they can join our team of doctors and help out with teleconsultations. We have, I think we can share our Twitter links and our Instagram page so people can reach out to us. Apart from that, we have a lot of doctors from the US and UK, consultants and specialists, who are also helping us out with, like I said, like for providing consultations on complicated cases, and they're also helping us in gathering resources, and they're also building communities back here in India where resources can be shared and help can be reached. So there are lots of ways to help out. It's alhamdulillah, and we're seeing that happen.
Okay, that is great. At the end of this, I'm definitely going to get those Twitter and WhatsApp connections, hopefully.
Definitely, inshallah.
We got one more question here. How are Indian physicians able to advocate for appropriate precautions and treatment despite the government's lack of response? Do physicians fear professional consequences for speaking up?
Right. So, yeah, I think despite whatever the government is doing or not doing, we have to keep continuing our work, right? So I think doctors have, they've been doing their part since last year, in fact, and everyone's been. There's definitely that, there's a term called COVID fatigue, which it's a fatigue that sets in after you've dealt with COVID for a long time. It's something that healthcare workers have experienced. But since the second wave started, everyone's been up and acting, and everyone's coming to work and doing their part. And yes, definitely there are healthcare workers who go back home and their family tells them that, you don't have to do this. You can quit. You're putting yourself at risk. You're putting us at risk. But this is the time to step up, and I think most people realize that. So everyone's doing their part despite whatever the government might be doing. I think the healthcare workers are still trudging on and doing their duties. Apart from that, yeah, there are lots of healthcare workers, a lot of doctors who are speaking out against, all the adversities that we're facing. They're trying to address all the misinformation that's going around, and they have been attacked by a lot of politicians on, that their licenses will be taken away. Uh, but they're not doing anything unethical. They're not doing anything illegal. So there's nothing that you can do. So that's a good thing. There are also people who are looking out. I just read an article yesterday of um, some politicians threatening some doctors, and there were some lawyers who were standing up for the doctors, saying that as long as you are following your code of ethics and you're not doing anything illegal, no one can disturb you. So just keep doing what you're doing.
Wow.
One of the that's crazy. One of the things that we obviously WhatsApp has a lot of videos circulating. WhatsApp is like the new news stream. We're seeing that there's doctors being physically abused by patients' family members, and the healthcare workers are being told to leave their houses because they don't want, the other people living in that same area saying that we don't want to get infected. Do you feel safe at where you're practicing right now, in terms of this scenario?
Yeah, Alhamdulillah, in this area, we don't see that sort of behavior. And I live in the campus of, where our hospital and the medical institute is located. So I think there's a good understanding of what we do over here. But there are definitely a lot of pockets, a lot of areas in Delhi, around Delhi, in the country where such mentality does exist. And we have to keep countering that. We have to keep spreading the right information. There's going to be, with such a huge population, there's going to be a variety of people thinking in a variety of ways. So, yeah, definitely share such sort of news.
Okay. We have about 8 minutes here before we wrap up. Just to give a good global picture of what's going on, Dr. Siddiqui, do you have any points you would just want to give quickly to Chicagoans and those of the diaspora here to spread information or what they can do locally? Because COVID's not over here either. I still have when you said COVID fatigue, I do have some anxiety that it's going to come back and I'm going to have to dress like a spaceman all the time, all over again. But Dr. Siddiqui, based on what you've been seeing lately, any advice to our community and what we should be doing this coming
Right.
year?
I was curious to know what's the situation like at your end.
Sure.
So, alhamdulillah, we've been doing a lot better than last year. The vaccine rollout has been not the best, but the healthcare workers got vaccinated, and we have an abundance of vaccines. Where I have family members who are pharmacists who actually sometimes have to throw the vaccines out, which is so horrible. But alhamdulillah, I think our community had tried really hard to get vaccinated initially. But it's funny. Yesterday, I went to go open iftar at this one restaurant. I'm not going to say the name of the restaurant, obviously, and it was like there was no COVID. No one was. It was jam-packed, small area. I don't think as a population or as a community we've reached the vaccination level yet to be, having parties like that or having, going into weddings, when you don't have that percentage of vaccinations done yet. I would say, the numbers are getting better. The numbers in the hospitals are getting better. Although we are seeing the people that are getting admitted to the hospital are a little bit more sicker than they were last year. And I don't know if it's because all the variants that have come in, the Brazilian variant, the South African variant, and I'm sure the Indian variant's going to be here as well. Um, but the numbers are controlled, and I think our population, about at least 40%, has at least gotten one dose of a vaccine, and about 20 to 28% are completely vaccinated. So I think the numbers are doing better here. We're doing better here. I think in our community, I think we still need to take precaution in when and especially Eid is coming up and gatherings. Yes, if you're 100%, if you have an attendance of 100% vaccination, I have no problem with people, meeting. But there is an issue that we're not close to that yet. So I would still tell people to take precaution. Saying that, like I said before, wearing a mask, and washing your hands, and distancing, it's just really easy to say all that, but it's really, really hard to execute that, 24/7. And that's where the problem is. If this disease was such easily controlled that, hey, just wash your hands, put sanitizer on, we wouldn't be in a pandemic. It's just try to be as aware of your surroundings, I would say, and be cautious of everybody around you, and inshallah still be safe. I honestly do think that there's a light at the end of the tunnel, inshallah, especially in the United States. I think we're heading there, especially we have this goal of getting completely vaccinated by July 4th, which is I guess a good date. But yeah, I think over here things are looking better, and we do have a lot of resources. So alhamdulillah, at our hospital, we even when in the worst part of the pandemic, we were still, alhamdulillah, fully staffed, had enough ventilators, had all the stuff that we needed. But yeah, so inshallah, still praying, Allah subhanahu wa ta'ala make it easy on all of us, and inshallah, may He protect us from this COVID, inshallah. I mean,
Inshallah. Yeah.
Yeah, no, I mean, I I get it, like where everyone's got COVID fatigue here because it's been like OCD every day, and like everyone's
Yeah.
like pushing it on you. If you're not vaccinated, you're a weirdo here. But I do believe this goes in the category of khuda ka khauf. Like we don't know like how this variant could happen. I've seen a couple patients who are fully vaccinated, Pfizer. I shouldn't say they were pretty sick. So we're not totally out of the woods. So I think it's a weird place to be. And then hearing of like my family members, my dad's friends, and that generation like losing multiple people, and then Aligarh University lost like 9 or 10 professors in the course of like 2 or 3 weeks. I mean, this is certainly not over for any of us in our heart.
Yeah.
So many close people are dying, even if we're, almost close to being out here. It's definitely taking its toll on our emotions and our thoughts. So, yeah, may Allah make it easy for everyone.
Inshallah. I mean,
Inshallah. Dr. Safa does some closing remarks. If there's anything you'd like for us to know, and people locally there as well, you'd want to put out there.
Yeah, so I think it's a time for everyone to do their part. So for anybody who's able to help out, please do form communities and get in touch with people who are on the field doing things, getting help. Doctors and volunteers, everybody, just try to be part of communities and groups and organizations so you can help out and do your part. Spread the right information. Do not believe everything you read on WhatsApp, and question things that you read on WhatsApp, and try to follow the right sources of information, and even some news channels. Let's not mention them, but yeah, you have to be aware of what you hear on them. Yeah. So yeah, and please try to help out in any way you can. I think the least you can do is donate to organizations that are working really hard to address the situation.
Absolutely.
Yeah, I think you did. I want to add a little bit to your point where you said about the news channels and WhatsApp and everything like that. Statistically, we are still going to see people in the ICU even after they get vaccinated, right? Because there's no such thing as 100% immunity against any of the diseases, right? So you're going to hear about that, but that should not deter you from not getting the vaccine or not being able to, do the things that you'd like to do after you're fully vaccinated. Statistically, we're going to see that, and there's no way it's going to come out. And the news media and social media, they're going to point out these little cases that, oh, hey, this person got such and so, and they got, they didn't end up doing so well, So we definitely have to try to filter that as well and put it into context.
Yeah.
Yeah.
We have to remember that there are risks with any sort of medication or treatment. There's risk with any of it. So a simple, a risk-benefit analysis of, how much you're protected or how much you're saved from, a severe disease by getting the vaccine. or how much you're putting yourself at risk by getting the vaccine. You just have to do a simple risk benefit analysis, and you'll find out that there's a very clear answer. So with Covishield, there's all the things about blood clots and all of that news. So it's happening, but the numbers are so small compared to the people who are being saved because of the vaccine. So just do your research and try to follow the correct sources of information, and don't believe everything you read. Yeah.
Absolutely. And on that note, it's 1 o'clock here, maybe 11:30 p.m. in Delhi.
Great.
I'd like to thank, what time? Okay. I'd like to thank. Okay, I'd like to thank Dr. Safar, Dr. Siddiqui for being here today.
Thank you for having us.
Yeah, I think the
Thank
game.
you. Thank you so much.
I think the game has changed in terms of relief work. So I'm just going to put this final plug with WhatsApp, Signal, Telegram, Facebook, you name it. You can get in touch with these people. So these big nonprofits are great. But, if you know somebody who knows somebody who knows somebody, you can get to those places and you can make those donations and really make change happen. That's what I love about this, that I'm talking to somebody who's really on the ground there. So stay in touch with Hayat Relief. We're going to continue to do work there and hopefully support
Inshallah.
these types of projects. I'm going to close with a dua. Bismillahirrahmanirrahim. Wal asr, innal insana lafi khusr, illa alladhina amanu wa amilu salihati wa tawasaw bil haqqi wa tawasaw bis sabr. Jazakallah, everyone. Assalamu alaikum.
All right, assalamu alaikum.
Well,